Welcome to the 2024 LACNETS Neuroendocrine Tumor Patient Conference. I'm Kavya Velagapudi, Executive Director of LACNETS.
I'm Lisa Yen, Director of Programs and Outreach for LACNETS.
And I'm Heather Davis, the Associate Director of Advocacy and Outreach for LACNETS. A heartfelt thank you to our 14 NET experts for contributing their invaluable time, knowledge, and understanding. Our annual conference would not be possible without the support of our presenting sponsor Novartis, Diamond sponsor Ipsen, Gold sponsor Crinetics, and Bronze sponsor Curium. Our YouTube channel features over 365 videos and podcasts. Use our playlist to find webinars on our previous annual conferences by year, various types of treatments, symptom management, patient and caregiver stories, and clinical trials. Follow LACNETS on social media to stay up to date on our upcoming webinars and NET news. We are on Facebook, X, and Instagram with the handle @LACNETS. And be sure to add us to your Safe Center email list to receive our monthly newsletters, podcasts, and dates of our next online or in-person educational event. And now I'll pass it back to Kavya.
LACNETS stands for Learn, Advocate, Connect Neuroendocrine Tumor Society. Our board includes Donna Gavin, who is the sister of LACNETS founder Giovanna Joyce Mbezi, and NET patient and patient advocate Mary Dunleavy, who has been living and thriving with NET for 19 years. LACNETS is guided by our Medical Advisory Council, made up of distinguished NET experts committed to improving the lives of NET patients and caregivers. Our partnership with Carcinoid Cancer Foundation helps us reach more patients and caregivers with our comprehensive educational programs, advocacy tools, and support groups. Given our full program today, we kept our introductions very brief, but please visit our website at lacnets.org to learn more about our history and programs. Now, I'm going to hand it over to Lisa.
Thank you, Kavya. LACNETS programs, including today's conference, are created for educational purposes only and does not constitute or substitute for medical advice. Please talk to your medical team about your individual care and treatment plan. Today, you will hear a lot of information from an impressive panel of speakers. This may be your first conference, and it might feel overwhelming, so please take breaks as you need. Feel free to pause, rewind, or rewatch, and rest assured, this is being recorded and can be watched again on our LACNETS YouTube channel and website. This conference focuses on NET, and you will find content on special topics such as high-grade neuroendocrine carcinoma, lung, and FIA-PARA on our LACNETS video library. Our hope today is to deepen your understanding of NET, so you will be empowered and know you are not defined by your disease, but instead you can live richly and fully as a whole person. I'm now going to welcome our moderators for today's conference. I'm pleased to welcome our moderators for our 2024 LACNETS Neuroendocrine Tumor Patient Conference. These are key figures in LACNETS who have served as co-moderators for our annual conferences and share their insights to help us better understand our NET journey. Welcome. I'm going to have all of them introduce themselves, and we'll start first with Beth.
My name is Beth DeBlaze, and I've been living with stage 4 neuroendocrine tumor for 8 years and was diagnosed in 2016.
Hi, my name is Mary Dunleavy, and I am a 19 and a half year patient living with pancreatic NET, and I am very happy to introduce my actual oncologist next to me here, Dr. Hendafar.
Thank you, Mary. My name is Andrew Hendafar. I'm a medical oncologist at Cedars-Sinai Medical Center, and I specialize in neuroendocrine tumors.
I'm Dr. Dan Lee. I'm a GI medical oncologist and lead our neuroendocrine tumor program here at City of Hope.
Thank you so much, Beth, Mary, Dr. Hendefar, and Dr. Lee for being with us today. So the first thing I'd like to start with is the fact that we hear all these terms: neuroendocrine cancer, neuroendocrine tumor, NET, neuroendocrine neoplasm, and carcinoid. Dr. Lee, we'll start with you. What is this disease that I have or that my loved one has?
So sure. So neuroendocrine tumors are really kind of a heterogeneous group of malignancies. And as you've highlighted, there can be different terminologies. And I think each of them are, somewhat slightly different, but many of them are somewhat synonymous with each other. And it's just based off of kind of how the classifications and terminologies have evolved over time.
Thank you, Dr. Lee. Dr. Hendefar, a lot of people wonder, is this cancer that I'm living with? What would you say?
Yeah, that's a good question. I always say it's not like a regular cancers. And that's because what makes these things grow are different in neuroendocrine tumors than other cancers. And the way that they spread, the speed with which they move. Neuroendocrine tumors actually are generally more indolent. They grow more slowly. They don't have the same genetic mutations, and the treatments are so different. So it's kind of like its own thing, its own beast.
It's unique. Thank you, Dr. Hendefar. So Mary, what does living with this diagnosis mean to you?
I would say it's honestly continually every day figuring out ways to get your life back with this diagnosis and ways to kind of support yourself in the face of the diagnosis. This process, I would say, must look different for everybody. And I guess the best way for me is I was just determined to get some version of my life back outside of the cancer diagnosis, and knowing it was still there, and sometimes it can be completely overwhelming, but really trying to get back what was important to me. And I know this has been said many times, but it's kind of grieving the loss of what the life was you had before, and kind of embracing the new one with the passions that you had before.
Thank you, Mary. Beth, what does living with this diagnosis mean for you?
What NET means to me when you receive this diagnosis is now you are on a path of uncertainty, and how we can progress and use that uncertainty to develop our resilience in coming up with coping mechanisms emotionally, spiritually, and find ways to have deeper meaning in our lives, so that we don't feel like we're just existing in this disease, that we're fully living with it and through it.
Yeah, thank you. Living with it. That's so important. So in this first section of the conference, we will cover what you need to understand as you're first diagnosed, and also just trying to get a deeper understanding of your disease. So we'd like to welcome our first speakers.
It's my pleasure to welcome Dr. Chandrika Chandrasekaran, a medical oncologist at the University of Iowa, whose lecture will be on understanding NET diagnosis, the workup, and what you need to know about your neuroendocrine tumors. I'm very happy to introduce Dr. Nadine Malak, who's a radiologist and nuclear medicine physician at the Oregon Health and Science University. She will be talking about understanding NET scans.
I'm very privileged to introduce a new patient story with Carla, and listening to her story and sharing her experiences deeply resonated with me. And I hope that by hearing it today, it will do the same for you.
And I'm happy to introduce Dr. Calicia Clark, who's a surgical oncologist at the Medical College of Wisconsin, and who recently was honored by President Biden and his team by being recently appointed to the National Cancer Advisory Board. So it's a really honor to have her here, and she's going to be discussing understanding surgery for liver NETs. I am also happy to introduce Dr. Julie Halle, who's a surgical oncologist at Sunnybrook Health Sciences Center in Toronto, Canada, and she'll be discussing with us understanding carcinoid crisis today.